Hi, I'm Steve LaRose from VITL, and in this video we'll talk about providing your patients with a clinical summary of their visit to your exam room. To achieve meaningful use, an eligible professional must provide clinical summaries to patients for more than 50% of all office visits within 3 business days. Now, some providers are saying that they're having difficulty meeting this requirement, so we decided to interview several Vermont providers who've been successful to find out how they did it. We'll also hear from one of VITL's experts, and at the end of this video, we'll have a set of steps that you can take in your own practice.
So, you're here for a sinus infection today?
I believe so.
What are your symptoms?
Practices that have been the most successful with providing clinical summaries tend to use a tag team approach that involves the entire staff. For example, nurses can update data such as medications, vitals, the problem list, and the reason for the visit. Physicians can then make sure they've completed the assessment and plan in the EHR before the patient leaves the exam room.
Have a great day. Hope you feel better.
Thanks.
Hello.
When the patient arrives at the checkout window, front desk staff enters information about the next visit, prints out the clinical summary, and hands it to the patient with a brief explanation.
All right. So this is the summary of your visit for today. It has the information the doctor has made comments on, any medications are on here, and it also discusses what happens at your visit for today. And you're all set.
Thank you.
Thank you so much. Have a good day.
You too.
Thank you.
It does take a little bit more time than what we used to do, but I think we've definitely found that it's been beneficial. The patients have all the information that the doctor is wanting them to see. It really wasn't very difficult for us once you just got in the routine of it. And one of the things that we did, we used to hand out appointment cards, but we actually don't do that anymore. It's right on the visit summary. So that was kind of the time that we took to write out the appointment card is now wrapped into to handing out the clinical visit summary, and the information is right there.
At home, not only do patients have a written record that they can easily refer to, they also have a better understanding of what they should be doing to improve their health.
I find it helpful to have the printed summary because I can take it home. Often I'm going to the doctor's as a part of a string of other errands. I may be distracted, so I can look at it when I have more time or when I've thought about what went on during the visit. For myself, what I notice is that being a visual person, having something I can hold in my hands and see is much more reliable, much more useful, much more calming than having to rely on my memory of a conversation in the office or upon my poor notes.
Patients really have reacted very well. They like having the information. We did have a couple of patients that we have decided that, per the doctor, that will not get a clinical visit summary because of some of the diagnosis that could make them a little more anxious, but there's probably 2 or 3 patients in our whole practice that we have decided to do that with.
Some providers mistakenly believe that they need to complete their entire note before the patient leaves the exam room. In fact, only a few key elements need to be done.
The workflow that seems to work best for us is that the providers are doing all they can to finish their assessment and plan prior to the patient leaving the room. That doesn't mean that they have to put in their cognitive discussion for a particular problem, say about diabetes and what you're thinking about. Just the diagnosis of diabetes needs to be dropped into the assessment and plan, the labs that need to be ordered, any referrals that are being made. And again, none of the detail behind any of these things that will constitute a part of the final note need to be done prior to the printing of the clinical summary.
I know of very few providers who do their notes as they go along throughout the day. They're usually catching up at the end of the day. But the patient summary isn't looking for a complete note. It's a summary. It's looking for the highlights of what has changed during that visit, so that the patient can walk away, and if it's an elderly patient, for example, with a son or a daughter who's looking after them, they can have the pertinent information as to what has happened during this visit to share with a family member or a parent or whatever the case may be.
Higher volume practices have found that using a patient portal connected to their EHR is the best approach to achieving the clinical summary measure.
When a patient is seen, the provider finishes that progress note for the patient visit, and once the visit is locked by the provider, which we do within a day or day and a half of the visit, the requisite information is automatically extracted from the visit note and pushed to the patient portal. We really don't have any interaction where we're handing the patient a piece of paper unless we elect to print the visit summary, which we almost never do.
After patients sign up at the office to use the practice's portal, they receive an email with instructions for logging on and selecting their password. Forgotten passwords have not been a problem, and the portal has been widely accepted by patients.
I've not heard of any patient feeling that the information was wrong or that they did not like its accessibility. I think we'll find some patients wish they had more information accessible to them electronically, and I think that will come as eClinicalWorks develops the portal. We have had some patients, I can remember one patient calling us back and saying they were dazzled by the portal. It's the only time I've ever heard that word used in medical communication.
Often practices edit the clinical summary template in their EHR. In some cases, items are reordered to put more important ones at the top. Other items, such as cognitive discussion, are removed entirely to make the summary more concise and patient-friendly.
I think we owe it to ourselves and we owe it to our patients to make the best of it. And like anything else, it has a lot of value if it's done the right way. We made sure that our clinical summary wasn't loaded up with a lot of text that people had to read. The sections are all very succinct and pretty clear, particularly when we're telling them that medications were changed or stopped today. They really like that reminder that things have changed.
And there's a number of items that need to be included in it, things that are relevant to the visit for the day. For example, if there were changes in meds or changes in an overall plan of what they need to be doing for home care, they need to make sure that that information is in the clinical summary. It doesn't need to be fancy. It can be very straightforward, clear, concise, short. I would recommend 1 page if possible. I think those tend to be read more.
Here are some steps you can take in your practice to be successful with clinical summaries. First, get everyone in the practice on board.
Everybody needs to know why this is important and stress that it's not just, oh, we have to do this for meaningful use, that there is actually some benefit to the patient from getting this.
Make sure staff are actually giving clinical summaries to patients.
They cannot print them to a file or put them in a PDF and save them on their computer. They actually need to be presented to the patient in printed format or even electronic format, for example, on a patient portal, or they could put it on a USB drive for that matter, or a CD, but it needs to be given to the patient.
Provide visit summaries automatically at each visit, not on request.
The secret tip is to try and do it every single time. And I think what is normally happening is that providers are remembering to do it when there have been significant changes. Not all of your patients have significant changes when they come in for a visit, so you really need to remember to do it every single time, and you'll hit that 50% mark fairly easily.
Mail the summary to the patient if it wasn't ready at checkout, or if there was a major change later when completing the note.
There are times that it's not quite ready, and so what I will do in those cases is if the patient's already been given that clinical summary at checkout and I know I made a substantive change to the chart, when I sign off I'll just print that clinical summary and we'll mail it to them.
And how often does that occur?
Maybe a couple times a week.
Look at whether using a patient portal would save time and money.
I think using an electronic portal is the simplest, ultimately fastest way to meet this requirement. If it's a small practice and you have the personnel to hand a piece of paper to the specific patient to whom it applies, it's doable. But if the practice has much patient volume or many providers. I don't see how it's easily doable without using an electronic portal.
Suggests that patients compare their medication bottles at home to the medications listed on the clinical summary.
I've actually had a lot of good feedback with that, where patients are calling and saying, you know what, this was actually different than what I thought it was. And so we have a lot better rate with accuracy with that. Patients are actually understanding what we have in the system versus what they're actually taking.
And finally, increase patient acceptance by coaching front desk staff on how to offer the clinical summary.
We were prepared for a lot of, oh, I don't want that, don't make me take this. And we really haven't had that at all. We've been very pleased with the patient reception. I think part of it has to do with the way the receptionist and the checkout person are presenting it to the patient. I think if you say, well, here, we got to do this for meaningful use, so I know this is just another piece of paper for you, so take this, they're not going to be as pleased as if you say, listen, we have this new thing in our computer that is able to tell you a little bit about what happened at your visit today and any of the changes in medicines and labs that have been ordered. And as they're handing that to them, the reception has been positive. I think you get out of the patient response what you put into the delivery.
We hope this video has been helpful and that you'll now find it easier to achieve the clinical summary requirement for meaningful use. If you still need more information, please contact us at VITL and we'll be glad to assist.